السلام عليكم ورحمة الله ومرحبا بكم مجددا في محاضرة جديدة من سلسلة محاضراتنا عن مراجعة أسئلة اختبارات البرومترك. Review of Prometric Test Questions. This is lecture number 1 in Pediatric Nursing. Today we are going to discuss 5 questions from question number 154 up to question number 158. معكم محمد عثمان يحيى. نبدأ مباشرة. Question number 154. The nurse is monitoring a child with burns during treatment for burn shock. Which assessment provides the most accurate guide to determine the adequacy of fluid resuscitation? The options are number A, skin trigger, number B, level of edema at burn site, number C, adequacy of capillary filling, number D, amount of fluid tolerated in 24 hours. وقف الفيديو هنا اختار الخيار بشيء صحيح. The correct option is option number C, adequacy of capillary filling. اللي اخترنا الخيار رقم C نشوف rational. Parameters such as vital sign, especially heart rate and urinary output volume, and adequacy of capillary filling and state of sensorium determine adequacy of fluid resuscitation. Although option number A and B and D may provide some information related to fluid volume, but adequacy of capillary filling is most accurate. So the correct option is option number C, adequacy of capillary filling. Question number 155. The mother of a 3-year-old child arrives at a clinic and tells the nurse that the child has been scratching the skin continuously and has developed a rash. The nurse assesses the child and suspects the presence of scabies. The nurse bases this suspicion on which finding noted on assessment of the child's skin. The options are number A, fine grayish red line, number B, purple colored lesions, number C, thick honey colored crust, number D, clusters of fluid filled vessels. وقف الفيديو هنا واختار الخيار بشيء صحيح. The correct option is option number A, fine grayish red line. اللي اخترنا الخيار رقم A نشوف rational. Scabies is a parasitic skin disorder caused by an infestation of Sarcoptes scabiei, its mite. Scabies appears as fine grayish red, thread-like lines. They may be difficult to see if they are obscured by excoriation and inflammation. So the correct option is option number A, fine grayish red line. Purple colored lesions may indicate various disorders, including systemic condition, and thick honey colored crust are characteristic of impetigo or secondary infection in eczema, and clusters of fluid filled vessels are seen in herpes virus infection. Question number 156. Permethrin is prescribed for a child with a diagnosis of scabies. The nurse should give which instruction to the parents regarding the use of this treatment? The options are number A, apply the lotion to areas of the rash only. Number B, apply the lotion and leave it on for 6 hours. Number C, avoid putting clothes on the child over the lotion. Number D. Apply the lotion to cool dry skin at least 30 minutes after bathing. وقف الفيديو نختار الخيار شو صحيح. The correct option is option number D. Apply the lotion to cool dry skin at least 30 minutes after bathing. اللي اخترنا الخيار رقم دي نشوف rational. Permethrin is massaged thoroughly and gently into all skin surface from the head to the sole of the feet. Avoid contact with the eyes. The lotion should not be applied until at least 30 minutes after bathing and should be applied only to cool and dry skin. So the correct option is option number D. Apply the lotion to cool dry skin at least 30 minutes after bathing. Option number A is incorrect. The lotion should massage it thoroughly and gently into all skin surface, not the areas of the rash. And option number B also incorrect. The lotion should be kept on for 8 to 14 hours. And option number C also incorrect. The child should be closet during treatment time. Question number 157. The school nurse has provided an instructional session about impetigo to parents of the children attending the school. Which statement, if made by a parent, indicates a need for further instruction? The options are number A. It is extremely contagious. Number B. It is most common in humid weather. Number C. Lesions most often are located on the arms and chest. Number D. It might show up in an area of broken skin such as an insect bite. وقف الفيديو هنا واختار الخيار اللي تشوف صحيح. The correct option is option number C. Lesions most often are located on the arms and chest. اللي اخترنا الخيار رقم C نشوف rational. Impetigo is a contagious bacterial infection of the skin caused by beta hemolytic streptococci or staphylococci or both. It most common during hot and humid summer months. Impetigo may begin in an area of broken skin such as an insect bite or atopic dermatitis. And lesions usually are located around the mouth and nose, but may be present on the hands and extremities. So the correct option is option number C. Lesions most often are located on the arms and chest. Question number 158. The clinic nurse is reviewing the healthcare provider's prescriptions for a child who has been diagnosed with scabies. Linden has been prescribed for the child. The nurse questions the prescriptions if which is noted in the child record. The options are number A. The child is 18 months old. Number B. The child is being bottle fed. Number C. A sibling is using Linden for the treatment of the scabies. Number D. The child has a history of frequent respiratory infection. وقف الفيديو هنا اختار الخيار بالشوف صحيح. The correct option is option number A. The child is 18 months old. اللي اخترنا الخيار رقمين نشوف rational. Linden is a pediculicide product that may be prescribed to treat scabies. It is contraindicated for children younger than 2 years because they have more permeable skin and high systematic absorption may be occur, placing the children at risk for central nervous system toxicity and seizures. So the correct option is option number A. The child is 18 months old. Option number B and D are unrelated to the use of linden, so eliminated. Regarding option number C, sibling and other household members should be treated simultaneously. شكرا جزيلا، نتقابل في محاضرة جاية. Don't forget to support us by comment, like or subscribe.